Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Thursday, August 13th. Welcome to our weekly video. I'm here again with Edward Brubaker, Living Branches President and CEO. Welcome back.
Thank you, Alex. Good to be back.
Let's talk a little bit, I guess. Well, first, let me summarize. I know everyone likes this part of the video where I say that we have no COVID cases anywhere right now from anyone who is at Living Branches, whether it's residents or staff. We are COVID-free at this moment. So we're all very grateful for that.
And COVID-free is also with a caveat that we have, it's been a few weeks since we did testing of everyone.
Yeah.
Certainly we test for symptoms and that kind of thing. And there's been some recent ones this week too that we needed to do that with again. So that's always going to be happening. And we are certainly exploring possibilities that are hopefully within the realm of what we can do for more regular testing, but we haven't figured that out yet. But yes, as far as we know, we are, and it feels very good to be at that place. It feels much different today than it did in April, May, and June, certainly.
Absolutely. So last week I talked a lot about the pandemic guidelines that were being released, and we are now, and especially for personal care, memory care, and healthcare, talking about the fact that now we have different steps that we can be at, and that can change depending on what COVID status is. So right now, everyone in personal care, memory care, and healthcare at Living Branches is in step 2, which means we've been able to implement some of our reopening planning. So we have, we're coming back to communal dining. We can come back to some more group activities. And perhaps more importantly for everybody, we have now more ability to have visitation. Have you had a chance to be on campus? Have you heard stories about how people are responding to this?
Yeah, I was just actually on campus at Doc Woods yesterday. And just a reflection too about, you were saying we could go back to previous phases, and that is true. I mean, obviously we want to focus too on the opportunity and the good news that we're at now. But I'm aware of a sister facility, not directly in this area, but they had one person test positive. I think it might have been a staff person. I can't exactly remember. And so they had to go back to the beginning. And so that's always the risk we have. And we need to be aware of that because those are always distinct possibilities. Having said that, it does feel good to be where we're at. And we want to focus on that too and the opportunity here. But yeah, I was on the Doc Woods campus. I can't say that I heard a lot of stories about the visitation and healthcare and personal care, but certainly observed the bistro being open. It was interesting, though, that my observation to Nancy was that it didn't seem like there were a lot of residents there. There were a fair number of staff having their lunch. But we've been banging that drum for so long of keep distant, don't come to the dining room. And so I think people got the message. And so turning that around is not going to happen on a dime. On the other hand, it's not like it went back to February either, because you're wearing a mask, you need to be socially distant. And the reality is when you're eating, you have your mask off. So there is more chance of a transmission. And so, yeah, it's just an interesting thing. People are very happy with the changes and want to engage in new and different ways. But you do kind of have that bit of a cloud over it too, to say, how does this all work and how's it going to feel? And so it'll take some time for that. And certainly it's not gone yet. So until we have a methodology, whether it's through a vaccine or testing or otherwise, to make people feel safer, it's going to be a long time until it feels like it did in February or January. But it definitely is good to be here. And I know the stories are that people are very pleased to be able to leave their rooms and to be able to come out to dining again, appropriately distanced, but certainly being able to see a different perspective, see a different part of the facility, which is a big deal. So we're very pleased with that.
I was talking to someone in life enrichment in personal care at Satterton, and she was sharing that they had a gentleman who lives there that they were taking down for a visit with his girlfriend. and that on the way down, they were telling him, hey, things are different now, and you're not going to be separated from her, so you'll actually be able to give her a hug. And evidently, he was so excited that he burst into song. And he was singing and whooping it up as they were walking through the hallways.
It would be interesting to know what song he burst out into.
That would be a very good detail. But yeah, I think I certainly have been hearing, and I have been hearing from a lot of families too, who right now, because visitation is longer, our time slots are all booked up. Mm-hmm. And so we're working right now. In fact, after this, I have a meeting with Life Enrichment at Souderton. We're working to see if there are ways that we can restructure how we are scheduling the visits so that we'll be able to get more people through. Mm-hmm. We had talked about the fact that per the guidance from the state, we're now able to have volunteers from residential living who might be able to assist with visitation. So we are exploring those options to see if we can get more time slots so that people will be able to get in more quickly. So stay tuned and keep watching the website as we make those changes. I know people will be very excited about that.
Right. I guess you could always do the night owl visits, the 2 a.m. I can't sleep. Is mom awake? Maybe I'll go visit mom for the 2 a.m. visit. But I mean, the reality is there's certain hours of the day that visits will take place. So there is a capacity issue.
Yeah.
And but we certainly want to work at making it as accessible as possible because it is just very important. People need this. People need it.
Absolutely. I can't believe I'm saying this. It seems like just yesterday, but it's time for the annual chicken barbecue at Souderton Mennonite Homes. Of course, this year we're not having 2,000 people on campus and doing the things that we would normally do. But next week is going to be a week of fun. We've got at Dock Woods, there's a singer coming. They've got ice cream truck coming. Souderton, they're doing a couple of interesting retrospectives on the auction. I mean, on the auction, but also on the barbecue. And then on Saturday, we're having still a concert, and still residents will be getting the barbecued chicken. So it's kind of nice to be planning those types of activities again.
Yeah, it is. And obviously, it's a virtual event this year. And a lot of things will be done over video or socially distanced appropriately. We obviously can't have 2,000 people roaming around our campus, but that's what's happening in a lot of places. There's an event this evening for a local senior center that's a virtual event, and there's an event in September for another not-for-profit that's virtual. So that's essentially what people are doing this year, and that's the reality. But it's still nice to be able to have some type of events going on that we need to be looking at. So, yeah, I think it'll be different. There's no question, but it'll be a fun time together. It was decided to try a virtual auction and online auction this year, and so as a way to do what had been the silent auction. And so we'll see how that goes, if it's something we want to continue in the future or not. But it was another way to stay connected. And so certainly people can go on our website and look at the things that are there. I don't think they're real pictures of the sticky buns that are being sold, but they look amazing, frankly. And so people can go in and bid often and early and often. But, it's a way to try to create some newness and change in our lives, to create some excitement, if you will, even in this time that we know we can't gather in the same way. So there's a lot of different things going on, and people have tried to be creative and working at these things to have some sense of normalcy, but also recognizing that it can't be like it was last year.
And I guess we could say for folks who are watching this that the auction is live through Sunday, and it's at livingbranches.org/auction. Very creative name we came up with there. But yeah, if you want to bid, by all means, go ahead and do that. So.
It's very easy to bid.
Yes, it is. And It'll even remind you if somebody's topped your bid, if you put your phone in.
That's right. It'll give you a text message, so it's very easy to use.
Yeah. Yeah. We're having an interesting time in marketing trying to figure out how do we take take the tours that we used to do to show people our campuses and convert them to some type of a virtual experience that still has meaning for people. Especially because for so long, what people have really said, the reason that they come to a Living Branches campus is the feel. It's the community. It's the way that they feel welcomed. So trying to figure out how to change that now to a virtual experience is very interesting. So we're not the only ones trying to figure it out.
Yeah, that's right. That's right.
Well, I think that's it for this week, unless you have anything else in particular that you would like to mention.
Well, yeah, I would just encourage people to pay attention to the website. That's where we give the updates. In looking at the guidelines and the things that are changing. There's some slight changes as we move into phase 3, but some of the changes aren't as significant, but certainly things with visitation and dining and other things like that. That's where you can get the latest information and really where we try to communicate and give the details of what's going on. But it really does feel good to be at this place. It feels like and seems like in Pennsylvania, we're still, I would say, somewhat stabilized. We need to keep our discipline. We need to keep wearing our masks when we're in public and in those appropriate situations. We need to keep doing those things to keep us safe so we can keep that tamped down. But it certainly feels good to be at this place, and we want to continue to make those changes within reason. But the opportunity, I think, the big deal is the opportunity for people to visit with their loved ones. I mean, that's huge, and that is so important, and we're just so happy to be at that place to be able to do that.
Absolutely. Thank you all. Again, if you have questions, feel free to email them to coronavirusquestions@livingbranches.org, and we'll see you next week.